Every year, thousands of children are affected by illness or injury, so knowing what to do is important, especially if you're a parent. When a child is sick or hurt, it can be a very frightening experience, but how you respond is vital. Basic first aid can often prevent the condition deteriorating or becoming life-threatening. The aim of these short videos is to give you the basic knowledge and skills to know what to do if your child is sick or injured. How you respond in an emergency situation could make the difference between life and death.
Gastroenteritis or tummy bugs are a very common problem for children. It's one of the commonest things that we see in the emergency department. Generally, it's a viral illness that is self-limiting and resolves itself without any treatment. But we want to tell you when to worry and when to come and seek medical help. Gastroenteritis, the children present with lots of frequent loose poos, sometimes associated with fever and sometimes associated with vomiting. But from your point of view, the most important thing to watch out for is whether the nappies are wet or not. If the nappies become dry, then the child is dehydrated and they need more support. Generally, the support that we give tends to just be oral fluids, which you can give at home as well. But sometimes we give intravenous fluids to help your child recover from this illness. Once your child has this illness, it's important not to spread it to other children, so hand washing at home and avoiding returning to the creche too soon is important so that the illness doesn't spread to other vulnerable children.
Most fits are not serious, but you may feel terrified watching it. Small children between the ages of 6 months to 6 years are prone to fits with a temperature, but most do not have epilepsy. At the start of an illness, as the temperature is rising, a fit can occur. Your child can turn blue, shake dramatically and froth at the mouth. Febrile fits are normally short and resolve by themselves in less than 5 minutes in most children. Any first fit needs an emergency phone call to get help. It is not likely to be serious, but you cannot be sure. First, you have to manage the fit with a little first aid. When a child has a fit, phone for emergency help, but also gently lie the child on his or her side on the floor in a safe place. Remove any nearby objects. Put nothing in the child's mouth. Note the details, what time the fit began and ended and what does it look like. Check the temperature if you have a thermometer close by, but do not leave the child alone to do this. Most children like to sleep after a fit and this is to be expected, so don't worry. Emergency help should be there soon. Years ago, people held down the tongue during a fit. Do not put anything in the mouth. It may make the child vomit and that can be dangerous. When your child gets to hospital, the doctor will examine your child to look for the source of the temperature. The majority of these are simple viral illnesses which all children suffer from. Some children react to these by having a fit while others don't. It is likely that your child may be sent home and not kept in hospital, but it is important to get your child checked out.
Asthma is really common. About 1 in 4 kids wheeze at some point. It may be triggered by a viral cold-like illness or in some kids by allergies like pollen. The child may complain of feeling unwell, or you might simply notice that they are breathless when talking. You may also notice that they've stopped running or playing because they are short of breath. Look for signs of increased work of breathing, like a faster rate, visible in drawing of the wall of the abdomen just under the ribs, or increased movement of the neck muscles just above the collarbones. You may hear noisy breathing, such as a whistling sound or other abnormal sounds. Any child with asthma should have an action plan. This is a set of instructions for what to do if wheezing starts. This should include using an inhaler, usually this blue one, through a special plastic device called a spacer. A spacer is simply a kind of plastic bottle or box. The inhaler is attached to one end and the child's mouth to the other. Younger children may require a spacer with a face mask attachment, as this will ensure a good seal. It's really important to use this spacer. It makes it much easier as the spacer holds the medicine in the chamber while the child inhales. To use correctly, shake it, remove the cap and attach it as shown. Then gently hold the mask against the face, or the child may put its mouth around the other end of the spacer. Press to release a puff of medicine and watch the child take 4 breaths. You can observe the valve move with each breath the child takes. The action plan will usually say how many puffs of medicine to give, 4 or 6 perhaps. Then wait a few minutes. If they are no better, repeat. If still no better, seek medical attention as a matter of urgency.
Accidents happen, and this is especially so for children. A broken bone is a common injury in a child, especially after a fall. No matter what part might be broken, or how big or small the injury may seem, all broken bones need medical attention. Your child's bone may be broken if you've heard a snap or a crack during the injury, if there is swelling or bruising or tenderness, if they are in a lot of pain, or they are unable to move the injured limb. It's important to keep the injured limb as still as possible. This can be done securing the limb to the body with a scarf or towel, or by resting it on a pillow or cushion. Keep your child calm and comfortable by giving them some pain relief, and seek medical attention at your nearest hospital as soon as possible.
Road-related injuries are the #1 cause of death and serious injury in children. To reduce this, make sure your child is in a correctly fitted car seat or child restraint for every trip. This needs to be age appropriate. Reduce your speed to under 30 kilometers per hour when driving in residential areas, and ensure that your child wears a bicycle helmet when cycling, on a scooter or a skateboard. Beware of driveway backovers, and always watch out for young children when reversing your car. To avoid drowning accidents, make sure your child wears a life jacket if they're in a boat, and teach them how to swim at an early age. Never leave a child alone in a bath, even for a minute. Be especially wary of ponds and pools if small toddlers are around. To avoid burns and scalds, always use child-resistant cigarette lighters and never smoke around young children. Have a working smoke alarm in your home and make sure you check it regularly. Beware of hot drinks. Put the milk in first when making tea or coffee to reduce the temperature. Preset the temperature for hot water in baths, and never leave an iron or curling iron plugged in or within reach of children. To avoid falls, avoid baby walkers completely. Use stair gates to prevent young children falling down the stairs, and window guards to avoid first and second floor falls. To prevent choking, avoid latex balloons. Also avoid drawstrings on children's clothes and pull cords on window blinds. Young children have a tendency to put everything in their mouths, so be vigilant at all times, especially if they're playing with toys that have small parts such as Lego, or if there are foods about like peanuts or popcorn. To reduce the risk of poisoning, keep medicines out of reach of or in child-resistant containers or blister packs. Be wary of household chemicals, button batteries and detergents, and make sure they are safely stored away.
Croup is a condition that causes swelling to the voice box and the windpipe, resulting in a harsh barking cough and hoarse musical sound called stridor. Stridor is usually more pronounced on breathing in, but can be heard on both breathing in and out. Croup is usually caused by a viral infection and affects children between the ages of 6 months and 5 years. Viral croup may start as a runny nose and a low-grade fever. The noisy breathing and barking cough frequently present overnight. A child with stridor does need a medical review by their GP or in the emergency department. The treatment for croup is usually steroids in liquid form. If the child has stridor when they are resting, then they do need medical observation until this resolves. More severe cases can require nebulized therapy. Croup can rarely be life-threatening, and in such cases a breathing tube is required to make the child's airway safe. In rare cases, other more serious conditions can mimic croup. Therefore, it is important to get your child seen if they have stridor.
In Ireland, constipation affects 1 in every 3 children. In 95% of cases, there is no known reason for it. This is known as idiopathic constipation. If your child is passing hard, dry stools with difficulty, less than 3 times a week, they may be constipated. If they are also having frequent accents, they may have impacted stools and are experiencing overflow diarrhea. This can be viewed by some as bad behaviour, but in fact the child has no control over this. If constipation is left untreated, it can lead to anal tears, which cause the child pain and in turn lead to holding onto the stool. There are some key points to remember. Know the different types of stool to identify constipation with or without overflow diarrhea. Type 3 and 4 are normal stools. Type 1